Doc Talk with Dr. Helene.
Hey guys, and welcome back to another Doc Talk with Hey Dr. Helene. I will be talking about all things internal medicine with these two lovely ladies and special guests. So without further ado, I will go ahead and let these beautiful ladies introduce themselves.
Hey guys, my name is Trey and I'm actually born and raised in Georgia. Went to school at the University of Georgia and then ended up back in Atlanta and went to medical school at Morehouse School of Medicine, and I'm staying here for residency.
Yes, ma'am.
Hi y'all, I'm Kendra. I am from Houston, Texas. I went to the illustrious Prairie View A&M University for undergrad. I went to Morehouse School of Medicine with these ladies for medical school, and I'm also staying here in Atlanta. I matched internal medicine at Morehouse.
Thank you ladies for this lovely introduction. So the first question we have is, why did you decide to go into medicine?
So unlike most people, I did not know that I wanted to be a doctor my whole entire life. I actually thought I wanted to be a vet, then a psychologist, and then I kind of realized that the best intersection would be going into medicine because I could help people, I could teach them about their value and teach them about how prioritizing their health would add quality to their life.
Yeah, I like that.
Yeah.
I wanted to be an FBI agent originally, and I realized that I really liked the human body, so then I thought I wanted to do forensics in the FBI. Then I realized that I actually just wanted to be a doctor, and that's mostly because I started to learn about how much control we have over our health in the form of like our lifestyle choices with exercise and diet, and that you can take really complex medical diseases, and the current data is showing we can even reverse many diseases through lifestyle, and so that's something that I want to be able to share with people and help people realize. Yeah.
Since y'all are both matched into internal medicine, why did y'all decide on that specialty?
So for me, internal made the most sense because I always imagined being an office doctor, not necessarily in the hospital. And you have that flexibility within internal. I like thinking a lot and problem solving and not as much procedures. And I like managing chronic diseases, so that's a lot of internal.
I actually realized that I really love hospital medicine. I really love getting to take care of patients when they're critically ill. It's very humbling to kind of witness how someone can come in with like an acute decompensated like heart failure or COPD exacerbation, and there are things that we can do literally inside the hospital to get them back up on their feet and doing a lot better. So I love that part of internal medicine.
So did you have any mentors along the way that kind of helped guided you into successfully matching?
So to be completely honest, I've had one mentor, and that was before I even got into medical school. I feel like I'm like more reserved and introverted, so I just felt kind of weird like reaching out to people. And I've always been the person that just does my own research. But I do think mentorship is important, but also there's a wealth of information already out there for you if you're like me and are a little bit nervous about asking for that help.
Yeah, so I have one mentor from undergrad that has been super instrumental in helping me get to where I am today. That's Dr. James A. Wilson from Prairie View. He's amazing. I wanted to work with Dr. Jennifer Rook, and she is our lifestyle medicine doctor at Morehouse. And I found her even before I applied to Morehouse, and I like read about her and I was like, oh, I really want to work with this lady, and I found her, and I've been working with her ever since, and I think she's awesome. So Dr. Rook does, she emphasizes a whole food plant-based diet, and that is using foods that are grown from the ground, produce, unadulterated, fresh fruits and vegetables for health. And so we encourage patients to eat this diet to try to mitigate some of their chronic diseases. They've done a lot to improve their health, and they've adopted the things that she's recommended, and they're doing really good. And she's been a wonderful mentor.
Were there any weaknesses in any of your applications that you had to overcome when applying to residency?
I could say for me, I think I had a little bit lower of STEP scores, and I was kind of worried that those scores were gonna hold me back from getting good places to interview, but I had an amazing interview experience and don't think that that was really something that held me back.
I would say for me, I didn't engage in as many like extracurriculars or like student activities While I was in medical school, I was more so like study. The little bit of organizations that I was in, I did try to have like a leadership role, and I tried to be in those for a long period of time to kind of overcome that.
Right.
And then even stuff I did in undergrad, I still tried to continue as much of that during medical school.
What do you think set you apart among your application?
I would say for me, honestly, they asked me more about what I did outside of medicine. So I think it is important to still be a human being, still be a person, and have things you enjoy.
Mm-hmm.
So a lot of times they've asked me about like my event planning that I do with my mom, because she has a business.
Oh, yeah.
And I still kind of do that here in Atlanta. Or like my baking, like my favorite recipes. I think I stood out because I was still a regular person.
Yeah.
I think for me, one of the things that helped me stand out was when I wrote my personal statement, I made sure to emphasize my interest in a whole food plant-based diet as a form of my like future practice pattern. And I was a little nervous about doing that because it's kind of radical, like I said before, and I wasn't sure how more conservative programs were gonna view me. But ultimately what I learned was that kind of just being my true self allowed me to kind of have interviews at the places that really liked me. And like I said, I had a lot of really good schools interview me, and I think that they liked that I kind of had a vision for my career and that I was so focused on it. And I think that that's something that set me apart from maybe other applicants.
In order to match into internal medicine, did you feel like you had to do a lot of research or get publications?
I didn't feel as much pressure as like a more competitive specialty. Not that internal medicine is not prestigious, but research is still important, and I think it shows your interest a lot. But I only had like one case report that I did.
Yeah, so I think that research is really important, and I had a few different projects that I've worked on over the years. I think more than anything, it just sort of lets the program know if you're interested in like continuing research and being a part of an academic type program versus maybe a community-based program. I haven't had any publications. I don't really think that it's vital, but it can set you apart, and it ultimately helps your learning process when you have to dig deep and learn about specific topics well enough to write about it in a paper. You're gonna know that topic a lot better.
Can y'all describe your interview experience?
Mine was very pleasant. I feel like more often than not, it was just like a general conversation. I had a few that would ask me like what I would do in different scenarios. So like if I was faced with conflict on a team I was working on. But the overwhelming majority were just, you know, what do you like to do?
I think that was very similar to my experience. My favorite interview, I think, I walked in and they were like, okay, here's our couple of standard questions, but let's talk about show tunes. And I was like, I love this place, exactly. So you can learn a lot about the program by the questions that they ask you, and if they're really trying to get to know you as a person, or if they're just, you know, going through the motions. So
what are your future goals or aspirations that you foresee when you become an attending?
So for me, I think I already know what I want to do, which is preventive cardiology, very similar to what Kendra was talking about. And I also know that I don't necessarily want to do medicine 100% for the rest of my life. So exploring other opportunities, maybe finding something where I can do event planning and maybe like networking events for women interested in medicine all over the country in fabulous places would be really cool. Being a mom, and a really great one, and a wife also. So those are like my biggest aspirations.
I would like to do a lot of what you said, Trey. I think the only other thing that you didn't mention is I want to teach and be affiliated with like an academic center where I can also help students and serve in a mentorship role.
So what do you see your day-to-day to look like? Time you go in, time you leave, that kind of thing?
I'd like to have the kind of schedule where like I wake up in the morning, go to the hospital, run the list with the patient, with the team and with the medical students, and you know, get working on notes and talk to patients and all that good stuff. And then maybe work out in the afternoon. Yeah, simple.
Okay, so for me, I see more of an outpatient schedule. which a lot of people don't know. Like, even when you have clinic as a physician, you still get there early. Like, you don't get there right at the time the first patient is there. So ideally, I would not like to wake up earlier than like 6, head into the office.
Okay, as an attending. I'm like,
as
okay,
an attending.
Sure.
As an attending.
Head in, finish up any like paperwork, documentation from the day before, get ready for the day, see patients all day, and then finish my notes. Ideally before I go home. I don't want to take work home, but I know that's probably inevitable. But just kind of have a schedule where I can still do things in the afternoon, you know, like work out, cook, all that stuff. Yeah.
I think I would also like to have some type of outside the work week scheduled kind of course or class that I can offer my patients and community members just on like the plant-based diet, and is able to answer their questions. And it's amazing because it like fosters community for people, and it's really hard to stick to lifestyle changes when you don't really have a support system and a support network. So
I really like that. I think that's a fantastic idea. So my next question is, so who are you outside of your white coat? What do you do outside of the hospital, outside of seeing patients? You know, what do you do for fun?
For me, I really like wine, tequila and margaritas, and eating at restaurants just like everybody else.
That's the one.
At one point, me and my boyfriend, he really likes like following DJs on Instagram, and so we'd like go to different bars and listen to DJs. And then
That's kind of cool.
regular day for me, I watch a lot of YouTube. I'm like addicted to YouTube, have been since 2012.
And you guys, she has a YouTube channel. Her YouTube channel is Dr. Trey. Definitely go follow her on YouTube. I will put her information in the description box below.
And I'm probably gonna start my YouTube channel, so you can look for me in a couple of months at plant-based Dr. Ivy, most likely.
Oh,
Just saying.
really?
Give the people what they want.
Give the people what they want.
You guys want vegetable recipes?
It's a real thing.
Okay, yeah, so just look for plant-based Dr. Ivy coming to YouTube, probably, you know, post-coronavirus 2020.
Anyways, you want to talk about what you do outside of medicine?
Oh yeah, so outside of medicine, I have a lot of hobbies. I try to be well-rounded. So I love to crochet, I like to garden, I love to hike, I love like all the natural, that's why I love Atlanta. There's like so many natural hike places around here. I like to play with my cat Robin. I love the Fox Theater, and I love listening to musicals. Yep.
Yes, that is definitely very true. Any other advice, just general advice that you would give to pre-meds, med students, just about the journey in medicine?
I feel like my biggest advice would be to have faith, because I feel like anytime we're fearful or scared of like putting ourselves out there to do something, because we don't have faith that it'll work out. If you have faith that if you put in the work it's gonna work out, then you won't have to be, you know, worried or scared. I promise you it will work out.
Yeah, like trust the process.
Trust the process.
Trust the process. That's right. So the thing that I would say, and I was talking to one of my friends who's in medical school right now the other day, and she was like, well, I don't think I'll be able to apply to this residency or that residency because online they said that their scores are this and I don't meet those minimum. I was like, honey, like sometimes like you just gotta put yourself out there. You never, like don't limit yourself. You know that, you know, they are looking for well-rounded students, so put yourself forward and don't be afraid, because the worst that they can do is tell you no.
Right.
But if you limit yourself, you'll never know where you could have ended up, and you'll end up exactly where you're meant to be.
So if you need to contact these ladies about anything that they have said, or you want more information, their emails will be in the description box below, and they will get back to you in a timely manner. With that being said, that is the end of this video. Thank you so much for watching. Please like this video. Be sure to subscribe and comment anything that you would like to see in future videos.
Oh, comment if there's a specific recipe that you would like to see veganized.
That too. That is all for this video, and I will see you in my next one. Peace. Y'all, peace.
Oh.